Hi, my name's Noel. I'm a psychotherapist. Welcome to my YouTube channel. Good to have you here. Do subscribe while you're here. Short video this morning on some of the benefits, I guess, of going to inpatient treatment for addiction, mental health issues, codependency. Let's just sort of look at some of those words first. Inpatient, what does that mean? It's residential. You'll live in the treatment centre. And there are various types of living within the treatment centre. The old horrific model of One Flew Over the Cuckoo's Nest, where you're locked up and you have all your rights taken away from you, is rare. And certainly not something I'd advocate. I mean, some people are arrested themselves and need sort of detention under the mental health legislation, but that's not what we're talking about today. So residential treatment in this context is voluntary, completely voluntary. You come and go. There will be rules about it, and you will lose the treatment often if you choose to go against the wishes or the clinical decisions of the team that have admitted you. But you're certainly not locked up in any sense whatsoever, and generally, well, it is always a very loving and supportive environment that you'll be going into with your best interests at heart. So mental health, addiction, codependency, those words. So mental health needs are where you have a primary diagnosis of a mental illness of some sort. Anxiety and depression are words that people use to say, I have a mental illness. There's other forms of mental health issues like psychotic illnesses and so on. Again, scary words, but you may well have a diagnosis or something like that. Often in the addiction field we come across cyclothymia or mild forms of bipolar, or sometimes bipolar as well. So you will have a mental health definition from a qualified mental health practitioner. And then the addiction and codependency stuff, well, you may well have had problems regulating yourself in relationship to other people, your feelings, etc., and turned to substances or activities such as sex and porn, or process addictions, again, such as eating food. You have an addictive relationship to eating food, either bulimic or anorexic, etc., overeating, compulsive overeating, these types of relationships to food, which are about trying to regulate feelings through an activity. And then the codependency is another way of doing that, but it's about trying to control other people, really, and trying to sort of manage uncomfortable feelings within yourself by a false sense of security gained from sort of manipulating, controlling other people. So I hope that covers some of the terminology. You can have more than one diagnosis, really, in this sort of context. You may well have a primary diagnosis of a mental health problem as well as a primary diagnosis of an addiction problem or a codependency problem. I would say most people I've met with addiction problems also have codependency issues. So I put those as part of a spectrum of experiencing. So that's some of the terms. I hope that's useful and makes them a bit more human. You know, quite a significant number of people do have these types of problems. In terms of anxiety and depression, it's quite common, really. 3 out of 5 of us throughout our lifetime will experience anxiety and depression, but not necessarily at the level to which we need sort of inpatient treatment for it. Some people may go through phases of having problematic relationship to drink, for example, but when the problems are over, they stop using the alcohol in that way. I'm not advocating you do that. It's a sort of a bad idea. You're better off getting emotional regulation through your human interactions. But that may happen, and you may no longer be a problem drinker. But an addict will carry on, really, with the substance. And because addiction is really about poly-addiction and cross-addiction, there are 14 different types of activities that we identify as being connected to it, and you may not know that. An addict often will cycle through one activity to another, so they put the drink down, they pick something else up. It's a bit like whack-a-mole, playing whack-a-mole. I don't know if you know that game from sort of the circus arcade type thing. So it's useful to sort of meet somebody and talk to them, if you, a professional in the field, if you have some worries about that. And then the codependency I would see as part of that continuum of addictive acting out. So there we are, that's sort of dealing with that issue. Why inpatient? Why go to a residential setting? I think there are a number of benefits to inpatient treatment. That you are taken out of your normal everyday life it can be a useful thing to do. Often change can be difficult to contemplate with the normal everyday interactions triggering you, such as your colleagues or your family or your friends, the local coffee shop or whatever it is, the local pubs, etc., the dealers around you. So to be taken out of the people, places and things that sort of trigger you into sort of a crisis around either your mental health needs or your addiction needs, it can often be very helpful to get out of that. Certainly the residential treatment centres I would recommend are also very, in and of themselves, very beautiful, calming, very healing environments, full stop. And that is conducive towards sort of getting well and learning. Learning is always a challenge to anybody. It always makes anybody feel an environment. But a lot of this recovery from addiction and mental health problems is about learning new ways of being. That can be itself quite scary. So having a group of people around you who are sharing that experience with you, and a group of professionals who understand how fearful that is and can support you compassionately and lovingly through that process, can be a really helpful thing. And not having to go back to the triggers each evening, but actually to sort of consolidate the experience. So you get this intense, not in a negative sense, but in a positive sense, you get this intense learning experience where you'll learn something in a group or one-to-one with your therapist, etc. And then you can apply it in the community that you'll find yourself in. And then think about how you transition out of that, which is about aftercare. But in the treatment centre itself, you'll get an assessment coming in and an agreement of what your needs are and a treatment plan within that, which will typically involve good food, good rest, good self-care, being part of groups that are, some of them will be psychoeducational, some of them will be psychotherapy, those types of groups, having a one-to-one therapist, having medical support. All of these needs, there'll often be people there that can advise you on financial issues, if you've got problems with work, etc., counsel you through that and coach you through some of those problems and help you with that. So you get in one place all the services that you need, which is one of the greatest benefits of residential treatment. You also then get a peer group, a group of people who are going through the process with you. Some will be further advanced and some will be behind you. And that sense in which you can learn from the people who are further advanced and teach or share with people that are newly arrived when you're a few weeks in. That's a really, really helpful dynamic in terms of personal growth and development, and really helpful in terms of trying out new skills and helping people learn and grow. And you learn a lot about yourself, really, from that process. And that peer group becomes a really, really valuable source of interpersonal therapy, to be honest. It's a very therapeutic, if that's managed well, and certainly the residential treatment services I know, that process is managed very well and compassionately, and that becomes a very powerful source of growth and learning. The reason being, we're social animals, and that's how we change. By reconnecting with that sense of being a social animal, being part of a compassionate herd in which everybody's in there to try and help each other and help themselves by helping each other. So you get this sort of very concentrated experience of growth and development and honesty and learning and sharing. And again, that can be very transformative in a relatively short space of time. And we're talking 3 months maybe, which is not a long time, but maybe longer for some people. So certainly primary care, I would suggest that you look at sort of longer than 28 days, more than a month really. A month will be okay just to get clean and sober, to be honest, but you'd want slightly longer to learn new life skills that'll keep you safe for the rest of your life. I mean, that's not going to happen in a month. So looking at 3 months, maybe more. And then when you finish that treatment phase, the intensive inpatient residential treatment phase, then you'll be looking at aftercare services and how you maintain the changes. If you're coming with the support of your family, often the residential services will involve the family in the treatment in a compassionate and kind way, but help the family to change as well, so that when you do go back home to your partner, your children, or to if you're younger, if you're living with your parents, for example, when you do go back home, there'll be changed behaviours in the home as well, which will support the changes that you've made. and help everybody keep going forwards in a very therapeutic and healthy direction. And then the residential service and me, if you want, will help you find treatment services here that allow you to maintain the changes that you put in place. I hope that makes sense of what goes on. It's more of a general overview rather than the technical stuff, but it's about entering into a very human and compassionate environment where your needs for change and growth are recognised on a very, very personal level, and then on a social level as well. So it's a sort of it's a very intense, very compassionate, and very loving experience of personal growth and change. I've not seen many people who haven't got something very profound from going into residential treatment. Some people go in, they don't want it really, but most people who want it really get something very, very powerful from the experience. And with appropriate aftercare and support and a realistic time scale, there can be some pretty remarkable transformations that take place on a very personal level and on an interpersonal level. If you'd like to know more about sort of residential treatment for yourself or for somebody that you're worried about, do give me a call. We can have a chat about it. It's 07 506 319 745. That's 07 506 319 745. So do get in touch if you'd like some help. Thanks for dropping by, and I'll be doing another blog soon. I hope you watch that one as well. Bye-bye.